In this presentation, you will learn how to measure a pulse and measure respirations. You'll need a watch with a second hand or a watch with a digital display. Ideally, you want to ensure that your patient is in a comfortable resting position. These are the sites in the body where you can measure the pulse. The carotid and radial sites are most commonly used. To measure the radial pulse, place the first two fingers on the inside of the wrist until a pulse is felt and count for 60 seconds. To measure the carotid pulse, stand behind the patient and place the first two fingers below the jaw and lateral to the windpipe until the pulse is felt. Count for 60 seconds. Be careful to not press too hard, especially when taking the carotid pulse, to not occlude blood flow. You can also count for 30 seconds or 15 seconds and multiply the beat count to calculate the heart rate. In infants, the pulse is most easily measured in the brachial and femoral sites. The normal heart rate is faster and has a larger range in infants and gets slower, and the range gets smaller as we get older. Many factors can affect the heart rate, including exercise, medications or drugs, disease, fever, age, and stress or anxiety. When counting respirations, you can watch the rise of the chest and count inspirations for 60 seconds. Or you can place the patient's arm across the chest and count inspirations for 60 seconds. When counting respirations, you are counting the number of breaths or respiratory cycles, which is one inspiration and one expiration. You can also count for 30 seconds and double the breath count to get the respiratory rate. It is best to count respirations without telling the patient because they could unconsciously breathe faster or slower if you tell them. When measuring respirations in infants, count for a full 60 seconds. Infants are episodic breathers, so counting for a full minute is more accurate. Finally, as with the heart rate, normal respiratory rates are faster, and the range is larger in infants. It gets slower, and the range gets smaller as we get older. Thank you for listening to this presentation, brought to you by the team at Health4TheWorld.